Good morning, friends. I'm Dr. Ashish Sabharwal, urologist, andrologist, and robotic surgeon from New Delhi, India. And today I have with me Mr. Greg from United States. He underwent Tactra penile prosthesis and Pyrenees disease curvature correction just 4 days ago. So he is here with me to tell his whole experience.
Good morning.
He is a 59-year-old male from United States and he came to us for erectile dysfunction treatment. He was looking for penile implant surgery. So we planned his penile implant surgery 4 days ago. We did the Tactra implant. He was not aware of his curvature, but when we did the artificial erection at the time of the surgery, that time we noticed that he had quite a big curvature, almost 45 degrees towards the left. So we did the curvature correction along with the penile prosthesis at the same time 4 days ago. So let us talk to him and ask him about his experience.
Good morning, doctor. First of all, I'd like to express my gratitude. I've been very satisfied with the whole process, from our initial meeting through WhatsApp and email. And that came after extensive research into my condition, researching it myself, talking to a few doctors in the U.S., and to find the most qualified doctor to pursue this that I could find available. Dr. Sabharwal's experience and the number of times that he has performed this process on the reviews that I was able to research and find on the internet, it gave me some confidence going into this. Through that research, I watched his videos, which some of them being in Indian. As I work out of the country, I work in Africa on a rotation, and utilizing the assistance of one of my Indian colleagues to actually, so I could take advantage of all the videos that were out there, not only in English but in Indian. So my focus was very straight going into this. I wanted to learn all that I could about it, find the best alternative for myself. I understand that for some people traveling overseas to perform a procedure, that may be undaunting to some people. I travel a lot. It's not an issue to me. I go where I think I'm going to get the best care, the most experience. And it just worked out very well. 100% satisfied with things, very satisfied across the board. From my initial contact with Dr. Sabharwal, he answered all my questions very, very directly. May not have always been the answers that I wanted to hear, but they were the truthful answers and helped me to facilitate my decision about how to go forward. From the financial side of it, Dr. Sabharwal and we mapped out the procedure that I would require. He came up with a price, and he has been 100% true to that price. There was nothing beyond what I was quoted. I found the process to be very transparent. In the surgery itself, I was awake through the process, had a spinal, and the anesthesia essentially from the mid part of the waist on down, and it was completely painless. The staff of Dr. Sabharwal, the anesthesiast, the people that were helping him in the operating room. I had the fortunate experience of being able to watch as I was awake throughout it, and I found them to be very professional. Very professional, no regrets in my decision whatsoever.
For how long were you suffering from the erectile dysfunction before you decided to have the implant?
For basically the last 2 years, I had a bad case of COVID, and it seemed like after that case of COVID, although I think this is more related to type 2 diabetes, it seems to have just impacted me from that point. One regret I have in that, it would be that I did not come, sooner to have this process done. The quality of life, I wish I would have had it done sooner.
Like after you decided to come to India, like how was the visa process? Was it easy? Were you able to get the visa very easily, or was it difficult?
No, the visa process was simple for me, and I had a redundancy plan in that as I said earlier, I work out of Angola, Africa. So I had done the research and knew there was an Indian consulate there and an embassy there in Luanda. That if I could not have done it fully online, I could take advantage of the in person. But as it was, I completed it online. Probably took about 10 or 15 minutes, and got that submitted online. Very straightforward. Not a whole lot of information. Pulling out your passport and answering some basic questions. I believe I submitted it on a Friday, and very early Monday morning, it was back to me with approval.
Very
So we're
nice.
looking, essentially 3 days to get approval there. It was very quick, and that was over a weekend.
Okay, very nice. So the visa process was quite easy.
The visa process was quite easy.
Okay, then another thing is that there are so many doctors in US. Why did you want to travel all the way to India for this treatment?
We spoke before about the fact that I do work out of the country and consequently work typically on a rotation, 5 weeks out of country, 5 weeks in country. And when you start pursuing a remedy through the insurance companies and the doctors in the US, there's a formality that they want you to go through and step through. And, when you're so frequently out of the country, in my case, that it's difficult to make appointments and the bureaucracy involved in that, I knew medicines didn't work well for me. With Viagra, just ended up with throbbing head and hot flashes, from taking a single pill. So,
You basically did not want to wait.
let's get the problem. Let's attack it head on and get it resolved. For me, certainly this was the most practical approach.
So how do you feel after 4 days of double surgery? Like you had a Tactra prosthesis and your curvature correction, both of them were done. Now the penis is nice and straight and definitely hard. So how do you feel about the whole experience?
It's been a good experience overall. As I said, through the process, there was no pain.
Right now, are you having any pain or?
No, I've got no pain now.
Okay,
The
nice.
only discomfort I really had and it lasted about it lasted about 2 seconds, 2 to 3 seconds, was just the removal of the catheter.
Yeah, that's
and it was uncomfortable. It was not extreme pain, but it was just a little bit uncomfortable when that came
Right,
out. The
right.
day after the surgery. I said earlier that Dr. Sabharwal, he takes, or Dr. Ashish, as often calling him, that by his first name, but he really, pre-operative, throughout the operation, and post-operative, he's really taking care of everything, all inclusive. It's been very straightforward to me when I say taking care of everything, totally inclusive. It include the post-operative medication, the antibiotics, the pain medicine, and which I can say I've been very comfortable. One fact has been, I think I told you a little bit earlier when we met today that I was out shopping for underwear. Had to find something that was a little bit more supportive, a little bit less revealing.
right,
So
right. So with the implant in, are you feeling anything abnormal or unnatural, or is it comfortable?
it's comfortable. It's comfortable. It's a little bit more awareness that going with a little bit tighter underwear now that certainly more pronounced.
Right,
in
right.
looser clothing.
Yeah.
So, and I think that urination, it's been fine, no issues with that. And, I've been comfortable. Obviously, for the next 4 to 6 weeks, as continue healing, the stitches themselves are self-dissolving stitches. So, anticipating in the next 4 to 8 weeks, those stitches will be dissolved,
Yes.
and back to life.
Yes, definitely. So in the end, like, would you like to give some message to the patients who are looking at the video and they're thinking of penile implant surgery? Anything you want to tell which you had a fear and now you say that, okay, that was a useless fear, kind of that. You want to tell something?
I would say, it's all about the quality of life, and life is very short. You want to maximize it as much as you can, and not settle for anything less. The travel may be daunting for some people, but it's really no big issue. I chose a hotel of my liking here in town, but every other step of the way, he's been there to assist. When I arrived at the airport, his man Manoj was there to pick me up, and it's been a great experience. A little bit of chance to see Delhi. I've enjoyed it. It's been very good experience. One that I do not regret, and I look forward. Obviously, this is something that you share in with your wife or partner, and obviously, it affects the quality of both of your lives. And my wife is very supportive of what I've done, and she's obviously been checking in throughout, and I think she's as happy as I am that the process has gone well, and look forward to things in the future.
Yeah.
But it's been a good experience, and I say no regrets. I personally found Dr. Sabharwal to be everything. He's been professional throughout, very direct answers to all my questions, supportive throughout the whole process. I found him to be a very honorable man, a professional doctor and a very honorable man.
Thank you.
So, those are some good accolades right there. That obviously, this is something I'm speaking freely here, that I underwent the process, and I'm thankful I did. Everything is good.
Great. Thank you, Mr. Greg, for giving an honest review about your whole condition. And friends, I hope you like this video in which Mr. Greg tells everything. If you are also thinking of undergoing penile implant surgery and you want to contact me, you can contact me by email or WhatsApp. My email address and WhatsApp number are given in the description. Thank you.